Hey guys, welcome to another episode of Our Ketogenic Life. We are going to talk about vitamin D. Vitamin D is something that is in the news a lot, especially with COVID. We're in February 2022, and a lot of people are taking vitamin D. And we need to talk about what exactly is vitamin D. And as a teaser, what is one thing that you must take with vitamin D? Not only to get the benefits from vitamin D, but also to help prevent some potential problems of taking vitamin D when we're talking about with calcium. And we're going to leave that to the end because I think it's just one of the most important things that you can probably take away from this podcast. Now remember, we are in the process of changing our podcast from just ketogenic to a more whole person functional medicine type podcast. And we're going to be changing the name pretty soon with this, but you'll be able to go back and listen to previous episodes. But just want to let you know that. And then also, the book is released. It's on Amazon. It's called Young and Strong at 40 and Beyond. If you guys would be so inclined, if you think it would be something beneficial for you, which I think it would be, is to go on Amazon, get the book. And probably one of the most important things you can do to help us out is to leave a rating. Now, I never ask for a rating unless you think it's something that is good. So if you find benefit from the book and you think others would find benefit, we would appreciate you leaving a 5-star rating. The other thing that would be beneficial for us as well to help reach more people who don't know about us is to share this podcast. Share it with other people. Give us a review on there. And when people come across our podcast and they don't know anything about us, but they see your review and they find you and they see that you found it helpful, then maybe they'll tune in as well. Because we just want to reach as many people as we can to get our message of health out to as many as potential people that we can. So let's talk about vitamin D. Vitamin D, I've got some notes here to remind me to go through these. But vitamin D is a steroid hormone. It's actually made from cholesterol. So when your body is exposed to sun, your vitamin D is made. Now, the stats that I saw, and I'm kind of like surprised at the low number of this, the stats that I saw was 41% of the people are deficient in vitamin D. You know, in my practice and what I see on a daily basis is I think that number is probably closer to 80 or 90%. And we're going to talk about what levels to get as far as to get the optimal range for vitamin D. But I think that there's a lot of people that have never been tested and they don't know that they're vitamin D deficient. And as you're going to understand from our podcast today, is why it's important to have enough of vitamin D. Vitamin D is something that's going to be beneficial in many areas, and we're going to talk about some of the things associated with that. So, when we talk about vitamin D, there's all kinds of forms with that. There's vitamin D2 and vitamin D3. Now, these are the most common ones that you see. And in the past, I even thought, well, there's not much difference between the two, but there is. I no longer prescribe vitamin D2 because that is more of the inactive form for the vitamin D. Vitamin D3 is more the active form, and it actually comes from animals. It can also come from like fatty fish. It can come from egg yolks. So vitamin D3, if you follow some of the things that we recommend, you're going to get vitamin D3 through your diet. But again, you have to be exposed to sunlight, and we're going to talk about sunscreen and sun cancer here in just a moment as well. But there is a difference between. So you want to make sure to get the best that you can is you need to get the vitamin D3 if possible. Now, vitamin D has to go through some stages as far as getting activated in your body. First, it has to be converted to what we call calcidiol and that is done in the liver. Then it has to be converted to calcitriol in the kidneys, and that has to do with some receptor sites in those tissues. And then what's amazing after that, it helps turn on and off genes. And we've talked about genes in the past before as far as epigenetics. So it can play a part in that as well. So if you're wondering what kind of vitamin to get with this, and we're going to give you a recommendation at the end, and some of these recommendations are going to be in our show notes, the things that I prescribe to our clients, is we want to make sure that we get the D3. And with the vitamin D, if you've gotten your blood test before and it's actually been low, usually the range is from 30 to 100 is what the range usually is on your blood test. Now, what I find amazing, before I give you the different optimal levels, is some insurances will not cover vitamin D getting it tested unless you have a diagnosis of vitamin D deficiency. Now, that just makes no sense. How do you know if you're going to have vitamin D deficiency unless you test it? And that's where we run into some problems with getting this tested through some commercial insurances, and especially with Medicare. So if you have these things, I think it's important to find out what the test would cost, even if you have to pay for it, because it's so important to your overall health. Now, when you're looking at vitamin D and you're looking at the values that you should get, the reference range, and we've talked about this before, reference range for vitamin D is from 30 to 100. And remember, a reference range is just what the average is across the field as far as like everybody's testing coming into these labs to see what the reference range is. That's much different than the optimal range. The optimal range is really where you need to have your vitamin level at. And ideally, we want to have this around 60 to 80 if you can. Even people who are supplemented, and we retest these people, a lot of times they're still in the low 30s or 40s. So sometimes we have to go up on their dosing. But it's important that we try to get as close to optimal range as we can. We don't want to just settle for being good enough. We want to be the best that we can. So this is what we're talking about with our functional medicine, is we want to get as best as we can, and that range is around 60. Now, vitamin D has a lot of things that it can be associated with. It helps regulate the absorption of calcium and phosphorus, which is we're going to talk about at the end with what you need to combine with vitamin D to get the best benefit. It helps with the growth and development of bones and teeth. Helps resistance to certain diseases. One of the things that's been talked about a lot lately is your immune system. And just kind of like going a little bit more in depth with that. Looked at an article on PubMed. It was in April of 2010, April 27th of 2010. And it helps regulate the cells in your immune system. Now, with all COVID that we've talked about in the last couple of years, and you've probably heard different podcasts or even on news stations and things like that, different kind of immune cells like macrophages, T lymphocytes, B lymphocytes. What it does is it helps regulate both. There's two different types of immunity that you have, and it helps regulate both of these. And that's the innate and the adaptive immunity. And we won't go into detail with that, but it's basically what you have in your immune system ongoing, and as your body adapts to new exposures to different viruses and bacteria. And it helps regulate both of these. So that's where the recommendations, as far as like if you have COVID or if you want to help prevent some of the symptoms from COVID, having an optimal level of vitamin D is where we need to be at. So what kind of deficiencies can be linked to vitamin D? Well, we just talked about, your immunity. So certain infections can do this. Certain types of arthritis and exacerbations can be associated with low vitamin D, as well as like inflammatory bowel disease, heart disease. There's something called osteomalacia, which is thinning more of the bones. Now, you may have heard of rickets. Rickets is something that is associated with bone disease in kids. We don't really see that anymore because most people at least get a sufficient amount to get in the reference range for vitamin D. So we don't hear about that much now as we did, centuries ago. Now, some of the things that vitamin D helps protect, it's been associated with helping with multiple sclerosis, osteopenia, which is the thinning of the bone, worsening of COVID and flu type symptoms, which we just talked about. There are some conflicting reports and studies showing improvement in mood and depression. I'm not sold on that yet because some of the studies that I've read, has not been the best studies to look at. So I'm not willing to go out and say that it helps with that, but I know it doesn't hurt with that. So why does everybody seem to have low vitamin D? Why is it when I check, my patients, it seems like nobody is hardly ever in the optimal range. They may be in the reference range, but a lot of people are suboptimal even in the reference range. Some of the things that are associated with lower vitamin D is darker skin as far as like absorbing sunlight, being older, being obese or overweight, not eating the right kinds of foods. We talked about, it being in animal products, the vitamin D3, which is the active form. If you're not eating, especially grass-fed, finished beef, if you're not eating fatty fish, like salmon, which a lot of people don't, they may eat tuna, but they're not eating the fatty fish. And a lot of people are staying away from eggs. Egg yolks, what we talked about just a minute. They have, or just a little while ago, they have vitamin D. Living farther away from the equator, which has to do with, being exposed to sun. A lot of people are also worried about skin cancer, and they stay inside. They're not out exposed like they used to be. And if you look at, the way our society is, a lot of things we do now is on the inside. We're not out as much. And some of the other things, especially with your GI tract, if you've had Crohn's or celiac disease, or if you've had gastric bypass, where your gut microbiome has been altered in the way you absorb things. So we talked about, some of the things associated with it, and one of the things we talked about just a second ago was skin cancer. So how do you balance skin cancer versus getting enough sunlight exposure? So one of the things is using sunscreen. The different UV rays are different as far as like triggering the vitamin D process, and then also causing skin cancer. And then also just getting out, even if you get out 10 to 15 minutes during the daytime and you're not getting sunburnt, that can help with your vitamin D deficiency. And then you can contrast that without not being out long enough to get burnt, which has to do more with skin cancer. So I'm not telling you not to get outside because, of the skin cancer, but I'm telling you to use, common sense as far as getting out for enough exposure and also using sunscreen, and you're going to get that balance between the two. So how do you know if you're vitamin D deficiency? What are some of the symptoms? Now, some of these are just kind of like generic type symptoms, and when I say by that is it could be anything. So, you could be tired, you could have muscle pains, aches, you could have weakness, you could have increased fractures, if you've broken bones in with minimal trauma. So, but I think the most important thing to do as far as like figuring out if you're vitamin D deficient is actually just get the blood test. You want to get the blood test just to make sure where your levels are at. Do you need to supplement? Do you need to increase certain things in your body as far as the foods? So it's really hard to tell as far as symptom-wise. There's nothing really specific for it. It just has a lot of general symptoms with it. Now, we talked about some of the foods as far as like, increasing your vitamin D. I always think starting with your food is probably the best place to start. We don't want to necessarily just always go to supplements, even though with vitamin D, I find a lot of people have to even supplement even on a good diet. And, that's for various reasons. So besides, animal products, besides fatty fish, besides eggs, what else can you do? Well, you can also have yogurt. Yogurt is something that has some vitamin D in it. Now, with yogurt, you want to make sure that it is not loaded with sugar. You want to make sure you read the labels. Some oatmeals, especially steel cut oatmeals, will help with vitamin D. Again, it depends on what kind of diet that you're on. If you try to do a lower carb diet, oatmeal is hard to do. Milk has some vitamin D in it. Personally, I don't drink a lot of milk because of the sugar content in it. If you don't know, it has about 12 grams of sugar per 8 ounces. So I try not to eat a lot or use a lot of milk. Can't remember the last time I had a glass of milk. So I try to get it from different things, and I try to look at my whole diet as far as what else am I eating, what else are my goals besides vitamin D, and how can I incorporate that. So one thing that I want to make sure is I get enough omega-3 fatty acids. So we'll eat more salmon, so we'll have that. I may add some kind of oils to it. For instance, cod liver oil, which has omega-3 in it, which I don't personally use right now, but is something that I've been thinking about adding into my regimen. Is good for your omega-3 fatty acids, but also good for your vitamin D. Now, Danae and I use a lot of salmon. We try to have that probably at least once a week. We're trying to bump that up to twice a week. So we want to make sure that we get enough. Now, we talked about just a minute ago about blood tests. We talked about being high, low, optimal. So let me give you some reference ranges that are used as far as where you need to be at. Again, the reference range is anywhere from 30 to 100. If you're less than 20, that's really, really low, and I would really consider making sure that you're getting some supplement with that. If you're 20 to 30 and you're eating a standard American diet where you're having a lot of processed foods, I'd start with your diet first. See if you can bump that up. The optimal range was what I said before, is around 60 to 80, so that's where we want to be. And then having too high of vitamin D can be over 100. Now, some of the symptoms with too much vitamin D, you can have kidney stones. Sometimes kidney stones can be associated with that due to the calcium. If you're getting really high with that, you're talking about vomiting, dehydration, confusion, increased thirst. So I've not really seen that before. It's not necessary to see something that is too high in vitamin D. Occasionally I'll get a patient back and they may be in 120s, 110, 120s, and we may cut down some of their supplement, but usually having too high of one is usually not a problem for that. Now, with vitamin D, one of the things it's mostly associated with is calcium intake. And with calcium, you need to have vitamin D to absorb calcium. Calcium, of course, we know is important for your bone, your muscles, your heart. And if you're not getting enough vitamin D, or if you're not getting enough calcium, you can have brittle bones. Heart disease can be associated with that. You can have muscle cramps, feeling weak overall. So you need to have that balance with it. So having enough vitamin D so that your bones can be healthy is one of the most important things that you can do associated with this. Now, at the beginning, I talked about what's one thing that you need to take along with vitamin D to get the most bang for your buck, to be able to get the vitamin D and calcium going where it needs to go. Now, we just talked about calcium, and you need vitamin D to get that absorbed. Now, one of the things that they found in the last several decades is there's something called vitamin K2. There's K1 and there's K2. K2 actually was discovered in 1929. And the importance that you have with vitamin D and K2 is when that calcium is absorbed, where is it going to go? If you do not have enough vitamin K2, that calcium can go to the arterial walls, and that's where it can cause calcifications. We want that calcium to go to the bones, and one of the things that you need to have enough of is vitamin K2. K2 will help direct that calcium to your bones instead of your arterial wall. So if you don't have enough K2 and you're taking supplements of calcium and vitamin D, it may be going to the wrong place. Now there's a difference between K1 and K2. K1 is found in like leafy vegetables. K2 is found in animal foods and fermented foods. And also what we talked about with vitamin D, it's in egg yolks, it's in also in organ meats. So if you have K2, it's going to help possibly prevent that calcium going to your arterial walls, which may help lessen your risk for heart disease. And at the same time, it's improving your overall bone health. So if you're eating a diet and it has, and you're eating like even lean meats, that vitamin D is a fat-soluble vitamin. So you have little of this, and also K2 is fat-soluble. You have little of this in the meats. So if you're having a diet with lean meats and you're trying to reduce your fat, then you may have a problem absorbing the vitamin D and K2. So what we want to make sure that is with vitamin D and with K2, that we're having some fatty fish with it. We're having some cod liver oil. You can even talk about, with olive oil and things like that, you're going to have some fat that helps absorb that. So that's why it goes back to like even with a ketogenic diet, again, this is not something that we recommend for everybody, but I think it's a good overall basis to get started for most people until we figure out what their genetics are and other testing to see if we need to go in a different direction. So you can see how important it is to have some fat into your diet so that you can get the results that you want to get. Now, when we talked about K2, a lot of vitamin D, vitamin K, a lot of people associate that with blood clotting and calcium metabolism and your heart disease. And now you can see where it comes from. But there's a difference between K1 and K2, and they probably, I would think, need to have different nomenclature as far as this because it gets confusing on which is which. But we want to look at for the K2 and make sure that that is with our vitamin D supplements so that we can direct that calcium where it needs to go and not into your arterial walls, but into the bones where we need it to work the best. So I'm going to provide a link as far as what I recommend in the show notes to you for the vitamin K2 and vitamin D. That's what I recommend a lot to my online clients. So if you're interested in checking that out, you can check that out. It's from a company called Full Scripts. So hopefully that's helped a little bit with vitamin D. Hopefully it's giving you some information as far as like what kind of levels do you need to look at. What do you need to supplement with as far as your vitamin D? And a lot of times people ask me, how much do I need to supplement? It really depends on your labs, but I think starting at 1,000 to 2,000 international units, that's IU, that's usually what you see after that number, is probably a good place to start. Make sure that you have vitamin K2 with it and that you're eating a whole foods diet that includes some fat, some good fat, so that you can absorb it to the best that you can. And remember, in the show notes, just take a look at the link and you can see if that will be something beneficial for you. So let's turn our attention now to our catechisms. We are in 44. It is, what is justification? It is God regarding sinners as if they've never sinned and granting them righteousness. So justification is almost like, a lot of people say this, is just if I've never sinned. God has forgiven us our sins like we've never done that before, and He doesn't keep a record of those anymore. He's forgiven us, and that's something that we do by asking Him into our heart and to be our Lord and Savior. So it's just, justification is just as if you've never sinned. It's by God's grace and His righteousness that He has forgiven us, and He did that by the cross. So there's hope. There's hope for each and every one of us. None of us are perfect. None of us have lived a life without sin, but we need Jesus' forgiveness we need God's forgiveness through Jesus' sacrifice on the cross. Anyway, hopefully that's helped. Hopefully it's cleared up some stuff with vitamin D, why you need to have for your immunity, because it does deal with some of your T lymphocytes and your B lymphocytes and things like that. That's what we're talking about with your immunity. And with COVID, that's a big thing as far as like people wanting to make sure that they can help prevent or lessen the symptoms of any kind of the diseases or any kind of the severity of the disease of COVID in their life. So reach out if you have any questions. Be sure you try to share this with people, let them know about it, and we will see you guys next week. Remember, be fit and be faithful.